Do you have to get worse before you get better when you take Accutane for acne? That's the question that we're going to address today. I'm Dr. Arthur Kolsky, founder and medical director of the Advanced Acne Institute, and our practice is a very unique dermatology practice in that we only specialize in the treatment of acne. So we have unique perspectives and insights that we like to share with acne sufferers on their way toward achieving clear skin. Now, all of the information that I'm going to provide today in this video is meant for educational purposes only and is not meant to be a substitute for direct treatment by your own medical provider. So let's get into the question. Do you have to get better before you get worse when you take Accutane? So a lot of people refer to this as the Accutane Purge. That's just a term that's an arbitrary term. It's not a true meaning of what's happening. It's not really purging. We don't know why this happens, but we do find in our practice that about 20 to 25% of our patients do experience worsening in the beginning of treatment. Now, we have no way of identifying which patients are at risk of having this worsening or this so-called purge, but we enlist the help of our patients to watch and make sure that they're not having any additional breakouts. And if they are, we ask them to call us right away so that we can take steps to try and intervene. So let's go into that a little further. So what do I mean by worsening of acne or Accutane Purge? So that means that from the baseline that you're developing extra pimples. So it could be just a few extra pimples, it could be a lot of extra pimples, or it could even be severe cysts that erupt. Thankfully, that's not as common, but we don't want that to happen to any degree. So once we identify a patient who's having extra breakouts or starting to exhibit worsening, we take steps to try and attempt to stop that from happening. Things like stopping the medicine temporarily and letting things calm down before we start slowly again. Oftentimes that proves to help us a lot in our practice. Also, changing the dose of medicine or changing the regimen. And once we get past that bump in the road, we find that things go fairly smoothly after that. Now, sometimes during the course of treatment, we increase the dose of Accutane for various reasons. And every time we increase the dose, we watch for the possibility of another episode of worsening. Typically, it doesn't happen. It usually happens only in the beginning of treatment, usually within the first few weeks, but that's always a risk once we change or alter the dose in an upward direction. Now, I mentioned that some cases of worsening, or purging as some people like to call it, can be very severe. In those cases, sometimes in addition to stopping the medicine, sometimes they need a different medication to help calm down the inflammation. But thankfully, that's not a very common problem, and most cases can be managed the way that I suggested in the beginning. So the answer to the question, do you have to get worse before you get better? The answer is most patients do not get worse before they get better. For those who do, it's important to take steps to try to lessen that in an attempt to stop that from happening. And once we get over that hump, for the vast majority of patients, treatment becomes very smooth. For the small number of patients who exhibit severe worsening, other steps need to be taken, but that's beyond the scope of this video.